Hi, my name is Marie. I'm one of the nurses in the office. We're going to be scheduling you for your outpatient procedure. I know you discussed with the doctor that you need to go ahead with an angiogram. So what I'd like to do is just go over some of those things that you'll need to do in preparation for it. First of all, we're going to need to get some blood work done. Okay, that can be done at any outpatient lab. So we're going to be giving you a prescription for that. You don't have to fast. You can take your normal medication for that. It's usually done a couple of weeks before the procedure so we can have all of the lab work that we need to make sure that you're okay to go through the procedure. Okay. One of the other things that we do is we usually let your doctors know that we're going to be doing that procedure as well. From there are some things you need to know prior to the angiogram being done. So I'm going to give you some instructions related to that. You're not to have anything to eat or drink after midnight. And there are certain medications that you should not be taking in the morning. So we're going to review those, and I'll be telling you those. And you'll get that information to take with you. If you're on blood thinners, we don't. Some of those medications need to be stopped 5 days ahead of time. So we'll review that with you and make sure you have all that information. Before you have your procedure, we'll give you the date and the time. You need to have somebody drive you home from the procedure and stay with you overnight. This procedure, basically, they give you an IV, they'll give you some sedation. You're going to be laying flat on a stretcher for the surgical procedure. You're drowsily awake, you're not all the way asleep. They're going to numb up your groin and thread a catheter up in and then inject dye. They'll take a series of x-rays. Basically what that does is it gives us a roadmap of what your arteries look like inside and gives us just a way to plan for surgery. All right. Sometimes when they're in there, they can balloon something or place a stent, and that intervention can happen at the time of the angiogram. Sometimes you need subsequent procedures, and you may have to come back for another outpatient procedure, angiogram, for the actual stent to be placed. We won't know that until the day of the procedure. After the procedure is done, it probably takes about an hour to an hour and a half of the procedure to be done. You go to recovery room for a couple of hours. During that time frame, you'll be able to have something to eat and drink. Your family can come in and sit with you. And then at that point, the doctor usually comes in and explains the results of the procedure and what we need to do next. And usually you come in for a follow-up appointment after the procedure. At that time, you'll see one of the nurses again, and then we'll be taking the next step, whatever that may be. And go from there. Hi, I'm Marie, one of the nurses in the office. I know we've met before because you've had some testing done and you've gotten the results of your testing, and now the doctor is telling us that you need to be set up for surgery. So at this point, you have an abdominal aortic aneurysm that we're going to be repairing. You're going to need some things done prior to that surgery. Usually what happens is we have to pick a date for surgery, so we'll be doing that. Once we get the date of the surgery and the place where we're doing the surgery, then we'll be scheduling you pre-admission testing, which happens about a week before the surgery. That's where you meet with anesthesia. They will draw blood work. EKG and a chest x-ray is usually done. You can take your pills and have a normal breakfast that day. There's no restrictions. The other thing that we need to do is you need to be seen by your doctors to give us a clearance for the surgical procedure. And that can happen. You may need to see one or two of them in order to give them, basically what they do is they're going to review with you your history and make sure that all the testing that they need so that they can make sure that you're appropriate for the surgical procedure that you're going to be having done. Once that's done, basically the day before the surgery date, the hospital calls you and lets you know when the surgery will happen. When you're at pre-admission testing, they're going to let you know nothing to eat or drink after midnight and what medications you need to take the morning of surgery. And then the phone call is made the day before surgery letting you know the time. Okay. All right. So the type of procedure that the doctor has decided you need is an endograft, okay? And that's basically a stent graft. And what they do during that procedure, it's probably an hour and a half procedure to 2 hours. It's done, can be done under spinal anesthesia or general anesthesia. What they do is they make an incision in each groin. about 5 or 6 inches long, and then they're threading a catheter up through. It's kind of like a tube within a tube. It looks like a pair of pants, but it's inside your artery. And what it does is covers over where the aneurysm is. So the aneurysm stays in place, the blood flow goes down through the stent graft. You'll have an incision. They seal it at both ends when they pull the limb down, and then they go through the other groin and pull the limb down on that side. And as I said, about 5 to 6 inch incisions in the groin. You'll probably end up with at least an IV for blood, obviously for fluids and things like that, a catheter in your bladder, oxygen, and basically your normal routine post-operative care. Patients stay about 1 day overnight in the hospital. They may go home the next day. It just depends on how you do. The staples stay in for 2 to 3 weeks. You'll come back to the office and they'll be removed at that time. And you'll need to call us and make an appointment for follow-up. Patients who receive endografts have to have routine follow-up, which means the CAT scan that you had prior to your surgery, you need to have repeated at 6 weeks and then every 6 months thereafter. And that's to check for placement of the graft and make sure there's not a leak to the aneurysm that's left in place and or that the graft has moved. Okay, so that's just one of our follow-up routine, and that's standardly what we do. Okay. Okay. If you don't have any questions, I think we can move on, and I'll be contacting you within the next couple of days with your appointments with your doctors. Thank you. Okay. Your doctors have decided you need an open aneurysm repair. So what I like to do is go over with you what that entails. You're going to have a couple of appointments that you need prior to surgery. One of which is pre-admission testing, where you meet with anesthesia. They'll do a kind of a physical on you. You get blood work, EKG, and a chest x-ray done at that time frame. You're also going to need to see your medical doctors, and you may see 1 or 2 of them. It depends. They will have to let us know at what is your risk factors as far as going through the surgical procedure, so we take their information and use that as well. So those things need to occur before your surgery. Usually the pre-admission testing happens about a week before the surgery date, so we'll have to call you with those appointments. Okay. Regarding the surgery, it's basically a 2 to 3 hour surgery. You're in general anesthesia. What they're going to do is make a side incision about 6 inches to the left of your belly button and about up to the first rib area. They go in from the side because your aorta lies just above your spine, and it's easy access. They don't need to move your intestines around if they were to go through the belly area. So you'll have that side incision. They're going to clamp above and below the area where they're working, and they're going to replace that aneurysm with a tube graft, and they suture that in place. Sometimes we need to do incisions in both groins, and that's because there might be some plaque or other aneurysms in there. So you may end up with a side incision as well as 2 groin incisions. They're closed by staples. Your stay in the hospital with an open repair is about 5 to 7 days. As far as how you recover, it just depends. The following day after surgery, you're going to be getting up, moving around, and depending on how well you advance your diet and how well you do, will be dependent on how you go home and when you go home. You'll see us in the office in 2 to 3 weeks to get the staples out. We don't want you to drive during that time frame, and we don't want you to do any heavy lifting over 10 pounds, probably for about 2 months. We'll see you back in the office. Usually we see you at 3 months and then 6 months and every year thereafter. And all your follow-up with the open aneurysm repair will be is an ultrasound in the office afterwards. And that's just to check to make sure everything's okay with the graft that they've placed in. And then you see the physician after that, and that's your normal routine. Yeah. Okay. At the time of your endograft, we just want you to be aware that if there were any complications, it could turn into an open repair. So just that you're aware. If that were to occur, then obviously your stay in the hospital would be longer and your recovery time would be longer. All right. If you have any questions regarding the open aneurysm repair, if not, then I'm going to contact you with your appointments for your clearances and for your pre-admission testing.
Okay, now we're going to do carotid.
Okay. All right. Hi, my name's Marie. I'm one of the nurses in the office, and I'm going to be reviewing with you. The doctor has told you that you need to have carotid surgery, so I'd like to just go over some of the surgical procedure as well as what we need to do to get you to the point of surgery. So first of all, you need to have a couple of things happen beforehand, one of which is pre-admission testing, where you meet with anesthesia. That's done usually a week before the surgery. We call you with that date and time. The other is that you need to see your medical doctors in order to give us clearance to go through the surgical procedure. So I'll be contacting those doctors and calling you with those appointments when I have them. As far as the surgical procedure goes, it is usually a one-day stay in the hospital. You're going to come in, go directly into surgery, and stay overnight. It's done underneath the anesthesia is a cervical block that numbs your neck and jawline so you don't feel anything. They make about a 3-inch incision on the side of your neck. What they're going to do is basically go in. The internal carotid is the direct bloodline to your brain. The reason to do this surgery is to prevent you from having a stroke. So we're going to clamp above and below where the area is blocked. We're going to cut the artery, kind of peel it back, clean it out, and suture it back together. That takes about 45 minutes to an hour to be done, and then the skin line is closed by staples. They put a light dressing over that, and then you go to recovery room for a couple of hours. If you can swallow some water that evening, they'll let you have something to eat and drink. The following morning, if you're feeling okay, your blood pressure is fine, then, and you eat all right, then we will discharge you home. Before you go home, we're going to take those staples out and put steri strips on. They should stand probably about a week to 10 days. They may peel back a little bit. If they do, you can carefully take them off the rest of the way. We would like you to make a phone call to us to make a post-op visit within 2 to 3 weeks. And during that time frame, expect that you're going to have some mild swelling and numbness on that area where we cut through the skin nerves. Those regenerate over time. You may have a mild headache. That's all normal. If you do have a fever or you have any drainage from the incision line, we like to know. If your voice changes any, we want to know. And just give us a call certainly if you have any questions regarding if you're not sure about something. Do you have any questions regarding the carotid surgery? All right, then I'm going to be contacting you within the next couple of days with your appointments.
Leg bypass, and then we're done.
Okay? Hi, my name is Marie. I'm one of the nurses in the office, and I know you discussed with your doctor the results of your angiogram, and we need to go ahead with a leg bypass. So I'm going to be discussing with you what we need to get from that point to surgery, and what appointments you need to do, and then the surgical procedure itself. Before we do the surgery, we need to pick a date for surgery. Since we have that date, we're going to go ahead and schedule you for pre-admission testing. That comes from the date of the surgery, and we usually call you with that, and that happens about a week before the surgery. Okay, yep. So at the time of pre-admission testing, you'll meet with anesthesia. They'll draw blood work, an EKG, and chest x-ray. It depends on what your other doctors have done in preparation as well. You can take your breakfast and take your pills that morning. That's fine. And as I said, our scheduler will contact you with that appointment. The other thing we need to do is we need to have you see your doctors so that they can clear you for the surgical procedure. You may need to see 1 or 2 of them. It just depends. And during that time frame, they'll give us that information back, and then we'll go from there. The other thing that you need to do is you need to come back when you're here for pre-admission testing. We try to work it out, depending on what hospital you're having your surgery at, that you get mapped. And mapping is basically an ultrasound where we mark on your leg where your veins are. So once we do the angiogram, that gives us a road map, basically, of what kind of surgery that you need. Okay? So now we're going to take an ultrasound. We're going to mark your leg to find a vein for bypass. And those markings need to stay on your leg. So your pre-admission testing and your mapping hopefully will happen within the same day. We try to do that. If not, then we'll contact you with those times. We'll work around whatever schedule you have. The other thing, as far as the surgical procedure is, you're coming in, you're going directly into surgery. It's done under spinal anesthesia usually. It can be done under general anesthesia. What they do is they're going to make an incision above and below where your blockage is. They're going to try to use the vein in your leg. Sometimes when they open things up, they can't use what they thought they could. Sometimes we need to do different types of surgeries. We hope that we can use the vein in your leg within the same blood supply so that we don't have to move anything. What they do is they cut the veins in your they cut the valves in your veins, which bring blood flow back up to your heart so that they don't work. And basically, they bypass around the blockages, using that vein like an artery. So you end up with 2 separate incisions closed by staples, all right? And it just depends on where your blockages are as to where your incisions will be and how long they will be. The surgery takes 2 to 3 hours, done under spinal anesthesia or general. After that procedure is done, you'll go to recovery room for a couple of hours after, and then you're admitted overnight, usually probably 2 or 3 days within the hospital. They have bed rest overnight. If your bypass is doing okay the next day, they'll let you get out of bed, walk around, eat a regular diet, and then depending on when they feel you're safe enough to go home and everything is all set for you, they will discharge you. We'll need to see you back in the office within 2 to 3 weeks to get the staples out. Prior to your discharge, your nurses will go over your medications you're going to be discharged on, and one of the things that we want to make sure that you're aware of is that you can take a shower, you can walk up and down stairs. Your only restrictions, basically, we don't want you to drive until you come back to the office to get the staples out. Elevation is important. We've taken a vein out of your circulation, which brings all the fluid that's in your leg back up to your heart. When that happens, your body has to take time to readjust. So you're going to have swelling in that leg, and then you may always have a little bit of swelling in general after a surgery, and it may be a longer period of time, 3 or 4 months. Okay, so you just want to make sure you elevate your leg above the level of your heart when you're sitting in a chair. We do want you to get up and walk around at home and do your regular activities of daily living. There's no restriction regarding that. Once you come back to the office, we take your staples out. If everything looks okay, then we usually see you at 3 months and then 6 months, and then depending on how things go with the bypass, it's usually routinely pretty much every 6 months. Do you have any questions regarding your bypass on your leg? Okay. Then I'll be contacting you with your appointments for your pre-op clearance and for your doctor appointments. Does that sound okay?
Yeah, that was great.
You sure?
Perfect. So are we going
Okay.
through to the